So hello everyone, welcome back to my channel. So today we are going to discuss about abrasion. It's a topic of forensic medicine and toxicology. So firstly we discuss about a few basic points about abrasion. So abrasion is the most common mechanical injury. So the most common mechanical injury is abrasion. This is the first point which we need to keep in mind. So what is the meaning of abrasion? Basically abrade means to scrape, hence there will be scraping of epithelium in abrasion. So the superficial layers will be affected in abrasion. So abrasion is superficial in nature. So it is a superficial injury, it is considered as a superficial injury. So abrasion is the most common mechanical injury. Abrade means to scrape, hence the epithelium will be scraped. The abrasion will be superficial in nature, it only involves the superficial layers and it is considered as a superficial injury. So here are a few more important points about abrasion. So as we discussed, only the epidermis will get injured in abrasion and there will be no scar formation in abrasion. So this is very important. So no scar formation in abrasion, and the blood vessels will be in the dermis, and abrasion does not involve the dermis, it only involves the epidermis. So there will be no bleeding. So in abrasion there will be no bleeding. Abrasion does not involve the dermis, hence there will be no bleeding in abrasion. So suppose this is the epidermis and this is the dermis. So the blood vessels are in the dermis, but abrasion will only involve the epidermis, this layer. This is a superficial injury, I told you, so it will only involve the epidermis, it does not involve the dermis. So there will be no bleeding in abrasion. So superficial abrasion will not bleed, so there will be no bleeding in abrasion. So here are the few important points to begin with. So abrasion, only the epidermis will get injured, no scar formation, no bleeding, because it does not involve the dermis. So these were the basic points which can be asked in the exam about abrasion. So these are the basic points. So now, having discussed about a few basic points about abrasion, let's talk about the types of abrasion. So types of abrasion. So basically there will be two forces applied. So here will be the epidermis and here will be the dermis. So epidermis and dermis. So if the force is applied in this manner, so this is the tangential force. So if tangential force is applied, so it will produce a scratch or a graze. So tangential force will produce a scratch or a graze, and it will produce either scratch abrasion or graze abrasion. So when tangential force is applied, there will be either scratch abrasion or graze abrasion. So these two types of abrasion will be produced by tangential force, like this, if the force is tangential. And there can be also perpendicular. So if the force is like this, so this is the epidermis, so perpendicular force. So if perpendicular force is applied, so it will crush the epithelium. So crush the epithelium. So it will produce, this crushing effect will produce two types of abrasion. First will be the pressure abrasion and second will be the pattern abrasion. So perpendicular force will produce pressure abrasion, pattern abrasion, and tangential force will produce scratch abrasion and graze abrasion. So we have four types of abrasion basically produced by two types of forces: tangential force, perpendicular force producing scratch abrasion, graze abrasion, pressure abrasion, and pattern abrasion. So four types of abrasion: scratch, graze, pressure, and pattern, produced by two forces. First is tangential force, second is perpendicular force. Now let us discuss about scratch abrasion. So this is the first kind of abrasion produced by tangential force, I told you. So firstly, let's discuss about scratch abrasion. So what's the first one? This single linear line of abrasion seen. So it is a linear abrasion. A single linear line of abrasion will be seen. There is only length and no significant width. So if you see the wound, there will be only length and no significant width, and it can be produced by a nail, thorn, or pin. And nail can compress on the skin to produce crescentic nail marks. So crescentic nail marks will be seen in case of scratch abrasion. If the abrasion is produced by a nail, then it will produce crescentic nail marks on the skin. So these are the important points about scratch abrasion you need to know. These are the points which you must know. So it is a linear abrasion, only length, no significant width, can be produced by nail, thorn, or pin, and produces crescentic nail marks when applied on the skin. So now next comes graze abrasion. So firstly we talked about scratch abrasion, next is graze abrasion. So very important to note that it is the most common type of abrasion you will see. So the most common type of abrasion you will come across is graze abrasion. So this is asked in the exam. So what is the most common type of abrasion? Is the graze abrasion. Multiple longitudinal parallel lines will be seen. So multiple longitudinal parallel lines seen in case of graze abrasion. So multiple lines of scratches over wide areas. Multiple lines of scratches over wide areas. So graze abrasion is common in road traffic accident. It happens when a person is dragged along a rough surface. So when a person will be dragged along a rough surface, it will produce graze abrasion. So graze abrasion is commonly associated with road traffic accident. We see graze abrasion only in case of road traffic accident, commonly in road traffic accident. And the other names of graze abrasion are brush burn or gravel rash or friction burn. So these are the three names associated with graze abrasion. We use it synonymously. So brush burn, gravel rash or friction burn. So these three can also be asked instead of graze abrasion. These three names can be given in the question. So friction burn, gravel rash and brush burn. These three names are also associated with graze abrasion. So graze abrasion is the most common type. Multiple longitudinal parallel lines, multiple lines of scratches over wide areas, most common in road traffic accident. We hear of graze abrasion only in road traffic accident, and also known as brush burn, gravel rash or friction burn. So the last two types of abrasion we discussed were produced by tangential force, as I told you. So now we are going to discuss about pressure abrasion. Pressure abrasion is produced due to perpendicular force. The perpendicular force will crush the epithelium, as I told you. So what are the important points about pressure abrasion we are going to discuss? So it is a mechanical injury where pressure is applied perpendicular to the body. So perpendicular to the body. So the examples of pressure abrasion are ligation mark in case of hanging and strangulation. So this is very important. This is important for pressure abrasion. So in ligature mark in case of hanging and strangulation, you can see pressure abrasion. And another important thing, the wound or abrasion has a parchment paper like appearance. So in pressure abrasion there will be parchment paper like appearance of the wound. So this is very important. This point you must note for examination purpose. Parchment paper like appearance in case of pressure abrasion, and also seen in bite mark. So pressure abrasion is also seen in bite mark. But the most important thing is in case of ligature mark. In case of hanging and strangulation, we mostly associate pressure abrasion, and there will be parchment paper like appearance in pressure abrasion. So what are the important points here? Firstly, perpendicular to the body, the pressure will be applied perpendicular to the body, producing pressure abrasion. And the example will be ligature mark in case of hanging and strangulation, and parchment paper like appearance of the wound in case of pressure abrasion. So next, after pressure abrasion comes patterned abrasion. So patterned abrasion is also important. It is also produced by perpendicular force. So why patterned abrasion? So you can easily understand, it imprints its pattern onto the skin. The pattern of the weapon is imprinted on the skin. So the pattern of the weapon will be imprinted on the skin. So it is also known as imprint abrasion. So pattern abrasion is also known as imprint abrasion, because why? The pattern of the weapon will be imprinted on the skin. So the pattern of the weapon will be imprinted on the skin in case of patterned abrasion, and it is also known as imprint abrasion. So examples are radiator grill mark on the skin in case of road traffic accident. So again, radiator grill mark on the skin in road traffic accident, and tire mark, the marks of the tire, if it is imprinted on the skin, so it is also an example of pattern abrasion. The fang mark of snake bite is also an example of pattern abrasion. So the radiator grill mark in road traffic accident, the tire mark and the fang mark of snake bite, these three are the examples of pattern abrasion. So in pattern abrasion, basically the pattern of the weapon will be imprinted on the skin. Next we are going to discuss about the age of abrasion. So it is very important to determine the age of abrasion. It is of medicolegal importance. We will discuss it further. So how will we determine the age of abrasion? So age of abrasion is determined by the color of the scab. So what is scab? Firstly, scab is the dried lymph node and the blood cells. So scab will be dried lymph plus blood cells. Dried lymph plus blood cells is a scab. So as the day increases, the color of the scab will differ. So as day increases, the color of the scab will differ, and the color of the scab will determine the age of abrasion. So the age of abrasion will be determined by mainly the color of the scab. Scab is dried lymph and blood cells, and as the day increases, the color of the scab will differ, and as the color of the scab will differ, different color will give an estimate about the age of abrasion. So determination of age of abrasion. So as we discussed, so the age of abrasion will be determined by the color of the scab. So when there is a fresh abrasion, there will be no scab formation. So then the age will be less than 12 hours. So the abrasion is less than 12 hours old. So if there is a fresh abrasion, no scab formation, then it is probably less than 12 hours. Next, if there is a reddish color of the scab, so if there is a reddish color of the scab, then the age of abrasion will be more than 12 hours. So basically these two you have to remember. After that, rest you can easily remember. First is if there is no scab, fresh abrasion less than 12 hours. If there is a reddish scab, then there will be more than 12 hours. Then the abrasion is more than 12 hours old. So after that, if there is a reddish brown scab, then the age will be 2 to 3 days. If there is a brownish scab, then it will be 4 to 5 days. If there is a blackish scab, then it will be 6 to 7 days. So it is very easy to remember: 2, 3, 4, 5, 6, 7. So reddish brown 2 to 3 days, brownish 4 to 5, and blackish is 6 to 7. So the color of the scab will gradually change from red to reddish brown to ultimately black. From red to reddish brown to black. So 2, 3, 4, 5, 6, 7. This is how you can remember. And the first two, basically you have to remember the first two. So if it is less than 12 hours, it is a fresh scab. If it is more than 12 hours, then it is a reddish scab, and the rest will follow: reddish brown 2 to 3 days, brownish scab 4 to 5 days, and blackish scab is 6 to 7 days. So abrasion will usually heal after 7 to 10 days. After 1 week, abrasion will heal. Now lastly, we are going to discuss about the medicolegal importance of abrasion. So what is the MLI, medicolegal importance of abrasion? Firstly, abrasion tells us about the direction of force. So basically, if this is the epithelium, so a tangential force is applied in this manner. So the epithelium here is scraped. So suppose epithelium here will be scraped. So this epithelium which is scraped is deposited here. So there will be deposition of epithelium here. The scraping of the epithelium occurs here, and there will be deposition of epithelium over here. So the epithelium which is scraped off and it is deposited will be known as epithelial tag. So epithelial tag, and it will be deposited at the tail end. So epithelial tags are basically seen at the tail end. Epithelial tags are nothing but epithelium which is scraped off. When the tangential force is applied in this manner, the epithelium which is scraped off and it is deposited at the epithelial tag will be seen at the tail end. So epithelial tags are seen in tail end. So the epithelial tags will determine the direction of force. So this is the importance of abrasion. The first medicolegal importance of abrasion. So it tells us about the direction of the force. Second is time since injury. So the time since injury, or the aging of abrasion, we can say in other words. So it will be determined by the color of scab. So as the color of the scab will differ, we can give an estimate about the age of abrasion. So time since injury is also we can get from abrasion. So estimation of time since injury is also from abrasion. So first is direction of the force, second is time since injury. The third is it gives an idea about the pattern of abrasion. So in case of patterned abrasion, we know about the pattern of abrasion. So the pattern of injury, say any type of weapon, if it produces a pattern on the skin, so we can get an idea about the pattern of the injury or the pattern of the weapon in case of patterned abrasion. So patterned abrasion has a medicolegal importance. And the next point is it gives a clue about what case it is. So abrasion can give you a clue about what case it is. So if the abrasions are localized in the genital region in case of females, then it can be a case of sexual assault. So obviously if the abrasions are localized in the genital region in case of females, then it can be a case of sexual assault. We can understand it might be a case of sexual assault. And extensive graze abrasion is also seen in road traffic accident. As I told you, graze abrasion is always associated with road traffic accident. So if a person has extensive graze abrasion over his body, so it can be a case of road traffic accident, we can tell. And crescentic nail marks in the perioral region around the mouth can indicate a case of smothering. So if there are crescentic nail marks in the perioral region around the mouth, so if if around the nose nasal area there will be crescentic nail marks, so it can be a case of smothering, right? So we can we can get a clue about a case, about what might have happened. So abrasion can tell you about sexual assault, in case of any sexual assault, in case of any road traffic accident, or even it can indicate a case of smothering. So this can so abrasion can give a clue about the case, about what might have happened. So here are our last few points which are important to discuss. So most of the abrasions are basically simple hurt. So abrasions are basically simple hurt, but corneal abrasion is considered as grievous hurt. So the one type of abrasion which is considered as grievous hurt is corneal abrasion. So what happens in corneal abrasion is basically there will be scarring in the eyes, and it will result in visual impairment. So corneal abrasion is grievous hurt. It is considered as grievous hurt, and all the other abrasions are simple hurt. So corneal abrasion is an exception where it is considered as a grievous hurt. And as we discussed the medicolegal importance of abrasion, so we can get so many information from abrasion. So much information can be derived from abrasion. We can know about the pattern of the weapon. We can identify the clue about what the case. We can identify the direction of force from the epithelial tag. We can say the time since injury. We can estimate the time since injury, and we can also estimate whether it is simple hurt or grievous hurt. So many information we can get from abrasion. So medicolegally, the most significant wound is abrasion. So the most significant wound is abrasion. So this is maybe asked. So what is the most significant wound? So abrasion is the most significant wound, and abrasion is definitely medicolegally superior than bruise. So there are also other types of injury caused by blunt trauma force. For example, abrasion is one type. There are also bruise. There can also be laceration. So from blunt trauma force, there can be abrasion, there can be bruise, there can be laceration. So abrasion is medicolegally superior to all. So abrasion is medicolegally superior than bruise, and is the most significant wound. The most significant wound medicolegally is abrasion. So let us make a quick summary of what we have discussed so far. So abrasion is the most common mechanical injury. It is considered as superficial injury. In abrasion, only the epidermis will get injured. It involves only the epidermis, and hence no scar formation, and there will be no bleeding. Types of abrasion: when tangential force is applied, scratch abrasion and graze abrasion; when perpendicular force is applied, pressure abrasion and pattern abrasion. Scratch abrasion, only length and no significant width. A single linear line of abrasion is seen, and crescentic nail marks. Graze abrasion is the most common type of abrasion, multiple longitudinal parallel lines, and commonly in road traffic accident. And pressure abrasion in case of ligature mark, in case of hanging and strangulation. Pattern abrasion, also known as imprint abrasion, radiator grill mark in road traffic accident, and fang mark of snake bite. So age of abrasion from the color of the scab. So fresh abrasion is less than 12 hours, and black is scab 6 to 7 days. Medicolegal importance: direction of force from epithelial tag. So time since injury from the aging of abrasion, and also the pattern of the weapon. And it will also give a clue about what the case it is. And most of the abrasions are simple hurt except the corneal abrasion, which is grievous hurt. Medicolegally, abrasion is the most significant wound, and abrasion is medicolegally superior than bruise. So this is all I had to discuss about abrasion. These are the important points which are important from examination point of view. Hope you all enjoyed the video. Thanks for watching.